Hello, and welcome to WHO Europe Answers, being broadcast live from UN City here in Copenhagen, Denmark. My name is David Barrett, and for the next 30 minutes, we are going to be discussing monkeypox. Now, the magnitude of the monkeypox outbreak poses a real risk. The longer the virus circulates, the more it will extend its reach, and the stronger the disease's foothold it will become. Now, as we've learned in recent years, and most notably with COVID-19, outbreaks of disease are often accompanied by an infodemic, a deluge of information that can feel very overwhelming. Now, this makes it difficult to work out how concerned you should be and how to keep yourself and those around you safe. What's more, a new outbreak opens the door wide open to the stigmatization of people who may have contracted the disease, which then undermines the health response. Now, today is a chance to cut through all of this noise and ask all of your questions about monkeypox directly to our expert panelists. I'm very pleased today to be joined by WHO Europe's Senior Emergency Officer and Monkeypox Incident Manager, Dr. Katie Smallwood. And on the line from London, United Kingdom, we have Dr. Will Nutland, who is the co-founder of Prepster and the director of the Love Tank, which is a not-for-profit that promotes health and well-being of undeserved communities. Dr. Nutland is also an honorary assistant professor at the London School of Hygiene and Tropical Medicine. So to both Will and Katie, thank you very much for joining us today and welcome. Now, for the next 30 minutes, we are broadcasting live on Facebook, on Twitter, and on YouTube. And you can, of course, ask your questions in the comments section or via on Twitter via the hashtag WHO Europe Answers. And we will get to as many questions as we can over the next 30 minutes. Okay, so I'm going to start off with Dr. Smallwood. Katie, just to start us off from the very beginning, what is monkeypox and why should I be concerned?
So monkeypox is a disease caused by the monkeypox virus, which is an orthopox virus, a family of viruses that also included smallpox virus, which is a disease that was eradicated in the 1980s. It's a zoonotic disease, so that's a disease that spreads naturally from an animal host to humans and then can spread within humans. And that's not unusual. Lots of the diseases that we're very familiar with are zoonotic diseases, including COVID-19. It's been circulating in the human population for the past 50 years, so several past decades. And the animal reservoir is endemic in parts of Africa, so mostly around West Africa and Central Africa. And in fact, over the past decade, we've seen a resurgence of monkeypox in endemic countries where we're used to seeing it circulate. So that in the past 10 years, in fact, we've seen more monkeypox cases than in the previous 40 years. So we've definitely seen a resurgence. It's a neglected disease, one that hasn't had the attention that it deserves. And what we're seeing now is an unusual outbreak of monkeypox, so one that's occurring outside where we'd normally expect to be seeing it transmit. And it's transmitting in people that don't have travel history to parts of the world where it's normally seen. And it seems to be sustaining its transmission. It's also being seen particularly in a population group, so mostly among men who have sex with men, and seems to be spreading very much as we would expect through close contact, but really through sexual activity. And that's really where the current driver of transmission is being seen. However, that might evolve in future. So that's why it's concerning to us at the moment, because it's a disease that we've known for a long time, but seems to be behaving in an unusual way and spreading in a new environment.
Thank you for that. Now, Will, as was being said, this is being spread through, at the moment, it looks like mostly through sexual networks and such, but with people coming together. Now, over the last couple of years, we have been in lockdown because of COVID-19. This is the summer where everybody is getting together. I can see here in Copenhagen, the beaches are open, the sun is shining, the barbecues are being fired up, and of course, all of the festivals have started. The music festivals, the street street festivals, the Pride festivals, etc. With so many people understandably excited about getting back to socializing and really enjoying the summer months, what should people be doing in order to keep themselves safe from monkeypox?
So, David, London is experiencing a heat wave right now. And if I look out of my window, I can see people who are deciding to take a long weekend and go and sit in the parks and sip cold drinks and have ice creams. So, of course, we've all been, around the world, been in COVID lockdown for so long. For lots of us, this is the first opportunity we have to kind of break free and go out and socialize and do all those things that we're normally used to doing. Now, there's been a lot of narratives in the press about the potential monkeypox risks or dangers of things like Pride events and festivals and big gatherings and people going and sipping beers and barbecuing on the beach. I think what's really important for us to say is that these festivals, these Pride events, these gatherings are not in and of themselves presenting additional monkeypox risk. It's what can happen at some of these events, and the activities that can happen can also happen outside of festivals and Pride events and big gatherings. Katie's just helped us to understand that we think right now monkeypox is primarily being transmitted through close physical skin-to-skin contact. So if someone goes to a big festival and gets very, very sweaty on the dance floor and they take their tops off and they're grinding against lots of other people's bodies, then there's the potential for monkeypox to be passed on that way. If they're meeting someone at a festival and hooking up back in the tent and sex is happening, then there's the potential for monkeypox to be passed on. But that can happen after an office party. It can happen in all sorts of circumstances. So what we've been saying at the Love Tank is that we shouldn't be necessarily pinpointing festivals and Pride events in and of themselves. You asked me, what can people do? Well, I think there's some inevitable learning that we can draw from other epidemics and pandemics from the past, and that's to provide realistic, real-world harm reduction information. So what we've been helping some of the large events in the UK to understand is to help the people who are either working at those events or people who are attending those events to really understand the symptoms of monkeypox. So if someone has recently been diagnosed with monkeypox and they're thinking of going to an event, then we are strongly advising those people to make sure that they've got proper informed medical advice before they head on site. And that's in part because they could still potentially pass on monkeypox. But lots of these big festivals and events are not going to be equipped with either specialist equipment or the ability to look after you if you become unwell. We know that in London, the vast majority of people who are being hospitalized with monkeypox are being hospitalized because of secondary infections to the lesions. So if you've had monkeypox recently and you decide that you want to go and let off steam at a big festival, there's a strong likelihood that your lesions could become infected, and then you would need much more intensive medical care. We're also asking people who are attending these events to really look out for the signs and symptoms of monkeypox and to access the on-site services that would be there to support people. I know a festival that I'm working closely with, they've issued a phone number, and if someone on site believes that they have monkeypox symptoms, there's a phone number you can call, and then very clear protocols to support people, including isolation procedures. And then I think there's other really important narrative about us all not only taking care of ourselves, but the people we're in close contact with. And we know that if someone finds out today or tomorrow that they have monkeypox, there's a real importance about when it's safe to do so, letting the people that you've been in close contact with understand that they have potentially been exposed to monkeypox, and then they can be advised by trained medical experts about what the next step should be.
Thank you very much for that. Now, you've mentioned a lot about the signs and symptoms, and you were also talking a little bit about lesions and such. Katie, for those people who might be unaware, what are the symptoms of monkeypox, and how soon, if I was to contract monkeypox, how soon would I see those symptoms after I've become infectious?
Right, so let's talk a little bit about how monkeypox presents. So there's an incubation period for monkeypox, which can be up to 21 days. From the point of exposure, you could develop symptoms within that period, but most of the time it would be between a week to 10 days. And first of all, people would tend to have what we would call a prodromal illness. So they might have a bit of fever, swollen glands, feeling tired, nothing very specific. And that then will be accompanied by the appearance of a very specific rash. And that might first look like a single bump on the skin. And that might be associated where the point of contact, as Will was saying, skin-to-skin contact is clearly extremely important here. And the site of infection might be where the first bumps tend to occur. People might have one bump, they might go on to then have further bumps, and then these bumps will progress. So the rash will progress into lesions that follow a very specific evolution. Now, what we've seen in some of these initial cases, or the first few hundred cases that we're seeing in Europe, is that these might not progress in the way that we've typically understood monkeypox to progress, which would be that they would all progress at the same rate at different parts of the body. But here what we're seeing is what we would call an asynchronous progression. So different lesions might be appearing and evolving at different times. And they will go through a process, each of them, where they will go from a small bump to what we would call a vesicle, which would be filled with clear fluid, a pustule, which would be filled with pus, and then they would scab over. Sometimes they can be broken open, they can leak fluid. That fluid might be infectious. So that's the typical progression, and that can take place over a period of weeks of those skin lesions. So this is a disease that can take a while to resolve, and that's important for people to understand as well, and that they will be infectious during that whole period, right until the moment that the lesions have completely healed and new skin is underneath them. We can also go on to see complications, and Will alluded to these complications. Several of the people hospitalized at the moment, which is not large numbers, but we are seeing hospitalizations, are being hospitalized because of the sequela that we would expect to see with monkeypox, and that can be secondary infections. Those can be because of the extreme pain. Some of these lesions can become really painful. And so we would expect some people to develop complications. And that's in healthy populations. There are other population groups where we might expect to see more severe outcomes from monkeypox, and that's young children and pregnant women and people who are immunosuppressed. And so although we're not seeing wide transmission in women and children at the moment, we are seeing cases, and that's where we've got to be really careful in terms of how this outbreak will spread, because it's certainly not going to target men who have sex with men just because of that. The outbreak will spread given the opportunities of transmission, which, as Will said, are not limited to any particular group or any particular event. They can happen in our daily lives.
Will, I mean, you bring up the different signs and symptoms, but we're also talking about a very specific group now. The bulk of the transmission, as you already said, is currently with one particular group of people, and that it's looking like that's inside the LGBTIQ plus community, and more specifically with men who have sex with men. But this is, as you've also alluded to, this isn't just restricted to them. But we're seeing, perhaps in the press, on social media, etc., for something which, for somebody of my age, looks like history repeating itself. So how do we address, and I'm going to ask Will this, how do we address a disease such as monkeypox and making sure people stay safe and looking after itself without stigmatizing any particular group and without undermining the health response?
I think that's a great question, and I guess we're probably of a similar generation. I lived through those very early days of HIV and saw the stigma that surrounded that. We've seen stigma manifesting around people being diagnosed with COVID, and in almost every disease outbreak situation, there's an element of stigma involved. And I'm sure Katie and I could actually do a whole event when we just talk about monkeypox stigma. I think it's really important that we don't let the stigma do more harm than the virus. I also think we have a really careful balance to tread here, and the vast majority of diagnoses that we're seeing in Europe at the moment are absolutely amongst gay and bisexual men who have sex with men, and pretending that is not the case does not help any of us. Talking about the potential of the outbreak developing into populations of that they may go into effect, as Katie has very importantly told us, is an important thing for us to focus on. But right now, there's a problem right in front of us, and it's really important that we do not shift resources away from where the problem is right now. But going back specifically to stigma, I think there are three things that I would highlight. And David, you've already highlighted one of them. Lots of the coverage in the press is not helpful, and my plea to people who are involved in the press is please stop telling mistruths. Please stop misquoting people like me. It's a big distraction. We spend a lot of time putting right those untruths, and it's really unhelpful. And please stop haranguing people who have been diagnosed with monkeypox. If they don't want to talk to you, they don't want to talk to you. Stop harassing them. For some of those people, my question would be, how on earth do you sleep at night? But that's a conversation to have for another time. My second issue around stigma is the role that we can play with each other. So how someone responds when they tell us how we respond to someone when they tell us that they have monkeypox will determine how they tell other people. If we're stigmatizing, if we're disgusted, if we're blaming, then there will not be an incentive for them to then go on to tell other people, including the people that they may have been in close contact with. And so if we respond with dignity, if we respond with compassion, if we respond positively without blaming, if we offer to be helpful, then that person will be much more likely to be incentivized to then talk to other people. And then finally, thirdly, our services and our organizations. I know that the vast majority of people who are providing diagnosis around monkeypox are exemplary, professional, brilliant people. I know that that's exactly the same for for most of those people who are providing services. But it's really important that when we're putting together information about monkeypox, that we do so in partnership. We do so in partnership with appropriate, skilled, community-based organizations. Collectively, we must be really careful of the language that we use, of the information that we put out there. We need to be careful about using phrases and terminology, for example, that we should avoid people who being in close contact with people who have rashes and skin conditions. Many of us have pre-existing rashes and skin conditions. We do not need to be even further stigmatized with unthought through messaging that suggests that people should stay away from us. And what I like to say to people who are producing information and producing those services is look at the service you're providing, look at the content you are providing through the lens of the recipient, and ask yourself the question, do I understand this information? Would I respond to it? Is it realistic and feasible? And does it add to any stigma?
Yes, of course.
I completely agree with Will, and I would just go to say that anyone who gets monkeypox has not done anything wrong. And I think that's really important. There should be no sense of shame in any of that. But importantly, what you then as a person do next with that information that you have is really critical at this stage, because what we do really need is everyone who thinks that they might have monkeypox based on the signs and the symptoms and who they've met and the context of their lives, going to seek help from a health provider, calling up someone and asking what they should do, and then really looking at the past few days and what you've been doing and helping your friends and sharing that information with people who you think might have been exposed. So I think that guilt or shame or anything related to the fact that you've got the disease should not stop you from well, first of all, you should not have those feelings. Those are not feelings that you should be having, and then you should really take action to protect others as well as yourself.
This is WHO Europe Answers, and we are broadcasting live on YouTube, on Twitter, and on Facebook, which means this is your opportunity to ask our experts the questions just by using the hashtag WHO Europe Answers or using the comment section. And in fact, we do have a question here from Facebook. I'm going to first ask Katie, and I'm going to hand it over to Will afterwards. The question is this: can you provide information on how many cases of monkeypox there are in the European region? And what should people do if they come into contact with an infected person? So first, Katie, over to you.
So the figures I'll give you are those since around mid-May, which is when we first started to receive reports of this transmission. Europe has, of course, had sporadic cases of monkeypox over the years, with most of whom are travel related, but they've not gone on to have further human-to-human transmission in Europe. So I think we had a press conference day before yesterday, and the numbers were around 1,500 cases in the European region since mid-May. But that's creeping up every day and is already approaching 2,000 cases. And that will continue to go up, not only because the outbreak is continuing to evolve, but also because people are looking for cases. More patients are reporting to healthcare providers to report that they think they might have monkeypox. So that's also contributing to the fact that the cases are rising. Most of those cases are currently in the United Kingdom, in Germany, in Spain, Portugal, France, but really we're seeing close to 30 countries in Europe now having reported cases. So it is quite widespread geographically, which again adds an additional challenge to how we respond.
Just with a slight follow-up there, it's not that I want to compare monkeypox to COVID, because they're obviously two very separate diseases, but I do remember with COVID, when it was the first 1,000 cases, or the first 2,000 cases, I was like, please, let's not get to 5,000. And then seeing how quickly that multiplied and increased over a very short period of time. Will, what should people do if they come into contact with an infected person?
So David, before I move on to that, I also want to draw on that comparison with COVID, because I think we've got so much that we can learn from about partnership working and rapid responses. One of the immediate differences between COVID and monkeypox is that we know that the smallpox vaccine is pretty good at protecting against monkeypox. There is limited stock of that vaccine globally and in Europe, but we do have the capacity to start thinking about much more proactive vaccine programs. And I know, again, in London, we're offering frontline sexual health staff who are likely to be the first medical person to come into cases with monkeypox cases, where they are being offered a vaccine. I don't want to see us in a week or 2 weeks' time reaching that 5,000 mark either. And there's one very smart way that we can start doing that, and it's that to really think about ramping up our vaccination plans as soon as possible. And I don't mean next week. I don't mean in a fortnight's time when we hit that 5,000 and that 10,000 figure. I mean now. We have the capacity, the capability, and the resources to do it if there is both the political and public health will to do that. And to be honest, I'm really, really fed up of sitting in meetings when we're talking about things that could happen in a month's time when they could happen right now.
Thank you for that. Now, one of the, coming back again to the COVID experience, is we have just gone through a couple of years, and in fact, many countries are still going through some really strong measures to fight against COVID, and that includes the use of masks, the use of respirators, lockdowns, all of that. And I know here in Western Europe, we've just come through 2 years of that. With regards to monkeypox, and Katie, this is for you, and this has come from a question from Twitter. Does WHO recommend the use of masks or respirators to protect themselves from monkeypox?
Well, another opportunity to talk about how monkeypox is very different to COVID-19. And that's not to say there are not parallels. We need to look very carefully at how monkeypox is spreading. And as we said right at the beginning, what is really driving the current spread of monkeypox at the moment is skin to skin, skin to mouth transmission, and prolonged contact at that physical contact, skin to skin level. Now, we do also know that monkeypox can transmit through contaminated materials, particularly from patients who have lesions that might be weeping and go on to contaminate towels or bed sheets or bathroom appliances when they're isolating at home. And there have been some indications that there can be some respiratory transmission of monkeypox where respiratory symptoms are involved or where there are lesions in the mouth or in the throat. So that's not to say, though, that the respiratory transmission of monkeypox is similar to the respiratory transmission of COVID-19, which is a respiratory virus spreading predominantly through that route, where we have to be careful about enclosed spaces at any time, and the readiness of spread of that particular virus, SARS-CoV-2, is very quick through the respiratory route. So we do have recommendations on infection prevention and control for monkeypox. Masks are a part of those recommendations as part of a broader set of recommendations in order for people who have monkeypox and for people who are caring for people who have monkeypox to protect themselves. And that's really important. And that can involve the use of a medical mask. In the home setting, for example, if you're at home and you're caring for a patient who has monkeypox and you can't maintain physical distancing from that person because, of course, you're looking after that person, then yes, we would recommend that a mask is used in order to protect yourself.
Katie, earlier this week, I was going to say I was reading about, but I know about because here being at WHO, the Director General and headquarters was talking about the renaming of monkeypox, and this goes back somewhat to the stigmatization. So a question from Dr. Caroline on Twitter is monkeypox actually going to be renamed? And if so, when will this be announced? I want to put a little additional part on that because I was having a discussion with friends, and there is like, but is it the monkeypox part, or is it the variations of the monkeypox which are directed at currently the naming at different countries? Is it that part which is going to be renamed? So what is happening there?
Well, so of course there's three elements to consider here. There's the name of the disease, monkeypox as a disease. There's the name of the virus that causes the disease, which is currently called monkeypox virus. And then there's the name of the two clades. So that is the groups of viruses that have a common ancestor, which are currently associated with geographic locations. So one clade is called the West African clade, the other clade is called the Congo Basin clade. So all the three of these things are up for question at the moment. And this is a discussion that's been long had, actually. It's not new, but it's really an opportune time to do so. And WHO and other institutions responsible for naming diseases and viruses do have some common principles, and that absolutely links to discrimination, stigma, impact that it might have on trade, travel, all of these things. The name of animals is not a good idea in terms of diseases that might actually give the wrong impression. We know that the animal reservoir and the animal hosts for monkeypox aren't only monkeys, it's rodents, it's and other species of animals. So all of these things are up for grabs at the moment. So the Director General announced that WHO would be looking at the name of the disease. There's another authority that's looking at the name of the virus. And we will also be working with some of our WHO groups to look at the names of the clades. And so those decisions and discussions will be taken in as soon as possible. I don't have a specific timeline on those, but I'm sure announcements will be made soon.
Well, I'm going to give the last word to you in 30 seconds. You painted a very enviable picture of summertime upcoming here in Europe, and with all of the outdoor activities and the festivals and the meeting of new friends, etc. For you yourself, over the coming weeks, will you be going to the family barbecue or the street party or the festival? And what would you say to your friends who are saying to you, I think I might want to go and enjoy my evening at that particular gig?
Sure, David, I think in these situations, we all have to take a balance between what we want to do for joy and pleasure and being sociable, looking after ourselves versus the potential risks. And we do that in every single part of our lives. I mean, every time we decide whether we're going to get on a plane or cross the road, we make these risk analyses all the time. Will I be going to a family barbecue? I doubt it, because I'm a vegan and all of my family are meat eaters, and they might they might pass on some kind of infection from their uncooked meat onto me. Will I go to a street party? Probably not, because I'm a bit of an introvert. Will I be going to a festival on Monday? Absolutely. Am I going to be having the time of my life? Absolutely. Am I going to be looking out for monkeypox symptoms before, during, and after? Absolutely.
Well, enjoy the festival on Monday, and I hope your family enjoys their barbecue. And for both of you here, a very big thank you to our guest, Dr. Katie Smallwood from the World Health Organization, and also Dr. Will Nutland. And this has been WHO Europe Answers. We hope you have found this last 30 minutes very informative for you. And for everybody here, we would like to wish everybody who is watching a great summer, and to remember to stay safe and stay healthy. Thanks so much.